Today I've been asked to talk about renal colic. Renal colic is the pain a patient experiences when they're passing kidney stone into their ureter from the kidney. Pain usually comes on suddenly, is quite severe, is a steady pain, although it can come and go a little bit. Pain tends to radiate into the groin area. They may have some flank pain. They may have some urinary symptoms such as urgency, frequency if the stone is as far as the bladder. On physical exam, there may be some tenderness in the flank region. The rest of the exam is usually okay. Diagnostic tests would include the vitals, and usually there's no fever. Urine testing would show some red blood cells in the urine. Plain x-rays aren't terribly helpful. The best screening test would be an ultrasound looking for any swelling of the kidney. If your ureter is being blocked, there may be some swelling of the ureter above that. If the stone is big enough, usually more than 4 millimeters, you might see the stone. The best test would be a CAT scan, but we don't like a lot of radiation, especially in a younger patient in regard to their gonads. But it's very specific, a CT. So first of all, the urine testing, you try an ultrasound to see if you could pick it up, and then a CT if you need to. But the best screening test in a young person would be an ultrasound. So an ultrasound is just sound waves, there's no radiation. It's like a depth sounder on a boat. It goes through fluid and picks up hard objects. You have to shoot through the bladder or the liver to see. There's no pain. The patient just lays down. You have some jelly on their stomach, and it's a scan that takes a matter of minutes. Results are really quite instant, although the technician can't really tell you the results. And usually the results are back in a doctor's office in 2 to 3 days. But for the most part, the patient's usually in the emergency department, and the results come back instantaneously from an ultrasound.